Hello, and welcome to the Minnesota Act Early and Follow Along Professional Development Series. I'm Dr. Jennifer Hall-Landy from the University of Minnesota campus, and I wanted to welcome everyone here today. It's a beautiful day here on campus, and the flowers are blooming, so we just wanted to welcome you and say happy spring. I am so excited for our topic today. Today we are talking about Help Me Grow and Help Me Connect. And so thank you so much for joining us. One other thing, our two groups that are hosting this again are the University of Minnesota's Act Early and Minnesota Department of Health's Follow Along. I lead several projects here on campus, one of which is our Act Early, and I'm going to have Krista put in some resources today, one of the sponsors of our webinar series. We have a wealth of free resources and materials, as well as our Minnesota Autism Developmental Disabilities Monitoring Network project. So Chris is going to put some of those links into start. And then I'd like to get started with a little bit of background. Next slide, please. So our webinar series goals, for those of you that have been here before, welcome. This will be a familiar page. For those of you that are new, also welcome. We just like to cover our goals for the day are we work to provide information and learning to support early and regular developmental monitoring of young children. We really work to promote in all of our webinars routine developmental screening using standardized tools. Our goal is to identify developmental delays, including autism, as early as possible. And we also talk each time a little bit about the early signs of autism. And one of our primary goals is to present to you resources for you to use in practice. And today, we will not disappoint. We have plenty of Help Me Grow and Help Me Connect resources. And we also will give you an opportunity to complete a survey where you share resources that have been helpful to you that we'll share out with the group. So lots of resources today. Next slide, please. So today is May 6th. We do the first Monday of the month every month, except for July because of the July 4th holiday. But today, it is the first Monday, about as late as we can get. I guess May 7th would be the latest. But May 6th, Help Me Grow and Help Me Connect. We're going to talk about early intervention and early referral resources. Next slide, please. Couple of housekeeping tips. We are in Zoom webinar mode because we have so many people, which we're so happy to have all of you. So you will be listening to the presentation, but we still would love your participation. So if you'd like to share a question or a comment, you can use the Q&A button. Here's our little arrow right here showing you. And then the resources will be sent out that are shared at the end of the webinar. But just to make sure you know you can participate, it's a little different than a Zoom meeting, but we still welcome your questions and comments. Next slide. One more housekeeping. Today we're going to start, and we usually move. Actually, I think I'm a little ahead of schedule. Yay. We have our introduction, which is me, 2 to 2:10. We'll then have a presentation, and we have two presenters today. So you get two for the price of one from about 2:10 to 2:30. We then apply our learning with a family story. So we take what we learned during the presentation, we apply it. That's our applied learning time to the family story, and then we'll have a discussion. So remember that Q&A feature again. And then at the end, the last 10 minutes, we will wrap up and provide you a survey code where we get your feedback and your resources. Next slide, please. So again, we have two presenters today, and I'm going to start by introducing our first presenter, Linda Mathiasen, and she has a very long and excellent bio. And so I'm going to read it, but Krista will also put it in the chat. Linda has been in the early childhood field since 2009, so she brings a wealth of knowledge. She loves leading teams, working on special projects, and providing training and outreach, such as what she's doing today. Her passion for children with developmental delays and disabilities began as a substitute teacher. Her experience includes increasing awareness of birth to 3 mental health and promoting the use of the Ages and Stages questionnaire, social and emotional, by physicians, teachers, and childcare providers. Yay. Since 2014, she's been working with the Minnesota Department of Education's Interagency for Early Childhood Intervention Committee, IEIC, it's a mouthful, performing outreach and training to see how children receive early identification and intervention services through Minnesota's Help Me Grow referral system. She recently was a business development consultant and a trainer for startup and existing childcare businesses. She served 8 years as a school board member and led a nonprofit serving families raising children ages birth to 30 with developmental delays and disabilities. Wow, just a wealth of excellent experience that we're going to benefit from today. Welcome, Linda. We are so happy to have you. And with that, I'm going to turn it over to you, Linda.
Sounds great. Thank you. Good afternoon, everyone. We're going to be talking about Minnesota's early referral system. So we'll go to the next slide. So what is Help Me Grow? It is one thing that we're very fortunate here in Minnesota have. It's truly where families take the lead in seeking additional support, or you can refer your child for a comprehensive, confidential screening and an evaluation if you're concerned about your child development, or if they have a possible delay that you want more information or a disability. So Minnesota's Help Me Grow is an interagency initiative, and so we are based by economic development region, and I serve region 6, which is in west central southwest Minnesota. We can continue. All right, so you may have seen our branding around the state. It's the Help Me Grow, and that's truly what this is. But it does come from the Minnesota Department of Education. And what it does is it connects families and professionals and family members to the early intervention system within our school districts. So you can see our branding there. We have our website, helpmegrowmin.org, which we'll put in the chat, and then also our phone number. So if you were to refer a child, you can either go onto our website, and we'll learn more about that in a few minutes, or make a referral via phone. So it is our goal as an IEIC, that interagency early initiative committee, to raise public awareness, to let you know that this is a free local resource for you, and you can receive materials that you can print, distribute. We have a lot of videos starting at birth all the way up to age 5 that you can look at and view, and you can also request. And these are for parents as well as professionals. I do a lot of outreach to physicians, but this is for school personnel, child care centers, anyone who's involved in early childhood. And it's truly to help you see how a child is growing, developing, and learning. Next slide. So you may be wondering about the IEIC and who is involved in this committee. This is in part of state statute. And so you can see, and hopefully you can find yourself on here. Our IEICs are required to meet a minimum of 4 times per year. You can see our school districts are very involved. If they're working birth to 5, we do have some school professionals that actually do early interventions up to age 7 that are on our committee. Public Health and Human Services, we have Head Start, Child Care Aware, Children's Mental Health, Homelessness, the underrepresented, and then we invite parents, and that is something that we're always looking to. So as professionals in the field, if you know of any parents that might want to participate to be involved in our committee around the state, we'd really like that referral, and you can reach out to us in the chat, and we can connect with you. And also tribal nations. It's wonderful to have their involvement. Slide. So developmental milestones, that is our term, or how we refer to how a child is learning, developing, and growing. And it helps us understand, is your child on track? Right now, I'd like to just share a video. This was created in Region 6, and it's actually from a collaboration between where I am in Wilmer area and the Litchfield schools and RCW. And so if you could go ahead and play that for us, Krista. It'll give you
Developmental
four
milestones
minutes.
are things that we can look at that show as a child how they're supposed to develop from the time they're born up until the age 5. At the helpmegrowmn.org website, they have everything listed there. If a parent is concerned about their development, they can make a referral on the Help Me Grow website. And from that point, we can start looking at the child's development. An evaluation typically takes about an hour. If a child has one domain that is minus 1.5 standard deviations or below, they qualify for developmental delay in Part C services. The main focus is that the child gets what they need, and the child is going to close that gap before they get to preschool. We want them to be able to function independently in their natural environment. The families can be involved and see what the providers are doing with the child, and they can take those situations and adapt them to the toys that they already have. I know it can be very overwhelming when you don't know how much is too much or when is the right call. But every journey begins with the first step, so they need to go on and make a referral as soon as they can.
Everything with Cecilia was normal to begin with, and then at her 4-month checkup, we went in and her provider, her doctor said that she has really low muscle tone still for where she should be at. When they pulled her up from a laying position, she wouldn't hold her neck up or to help at all, and most 4 months old are doing that already. It led us to a diagnosis. She was missing or having a deletion of her 22q13 chromosome. As a parent, everybody wants their child to be healthy. That's what they want, and to hear that your child's going to struggle is really difficult. We went through all the doctors and all the appointments, and it is trying to figure out how do we give her the best life with the most opportunities that she can do. We were recommended to talk with the school about the early intervention program early. So we talked with them, had a meeting, and they came and did a very brief evaluation of just what she could do and what she couldn't do. And we qualified for those services. So then they put a plan for us together and how many visits we wanted with each of the providers. In the beginning, they came to our house as part of that program, and it did services in a friendly, known environment of our house with toys she liked to play with and different things that we could use at home. We had to do a formal IEP meeting when she turned 3 so that we could transition her into school services. When we have meetings here or conferences or different things and they tell me she's come so far, she can do all these other things. It's good to hear that other people are seeing that big progress that she's making where she came from. Barely being able to sit on her own, to jumping on a trampoline and just running around finding the things that she wants to be doing. Take advantage of every service you can. I look back at where she was at 4 months and I don't know if we'd be in this point with how far she's come without all those services. She is a joy. She's the sweetest little girl, and all those people along the way guiding us through the process, giving us the information, that's why we are where we are today.
Every mini step is a mountain. We celebrate every single thing. It's those little things that are going to help them be successful throughout their lives, and it's all because that they got into this early intervention program and had those goals to work towards, and that family involvement and the teacher involvement, and everybody's involved for the child. Meeting Cecilia and hearing that she started at 4 months and now she's 4, and she was going all over the classroom and jumping and using her communication board. It's such a validation of what this program can do for a child like her.
So that gives you a little insight on the Help Me Grow and the referral. Like, what does that look like from a parent's perspective? And then the child receiving early intervention through their school. And she started much earlier. If you caught that, she was identified by her doctor at 4 months for having a possible delay. And then they were able to look into things and identify what kind of services and supports Cecilia could have. So the next few slides, we're going to talk a little bit more about how do you find Help Me Grow and who do we serve? Again, refer early. We really want to see early supports and services, and it is provided through schools and also through our service cooperatives. Some of you may work for our cooperatives, but there are top reasons. We're always looking at our littles. So it is birth to 2 that we really want to see, because the earlier the intervention, the more effective. We know that it's easier to qualify for services through your local school district. Services are offered year-round because once a child turns 3, it changes. The funding changes, the delivery changes. And so again, birth to 2, services are offered year-round. Services are provided in the child's natural environment. And so what does that look like? Our early interventions would come to your home, to grandma and grandpa's, to childcare. If you wanted to meet at the school, that is fine too, but that's kind of for the birth to 2. And then beginning at age 3, it changes because now a child that has a developmental delay or disability, it must impact their learning. So as you can see here on the slide, it must demonstrate an educational need. And so if you have a speech delay, that may not impact your learning at early on, but it might take a while before it actually does, or maybe it never does impact your learning. So that's how the services kind of change based on birth to 2 to age 3 to 5. And services are school-based. Next slide. Who can refer a child? I kind of alluded to this earlier. Parents, family members, family and friends. You can go onto our website or our 800 number, child care providers, school personnel, child protection workers through the county, doctors and healthcare providers, community, as well as anyone else who may be concerned with a child's development. And yes, you do not need parents' approval to refer a child, but we know working in this space that we want you as the early childhood professional to create that bridge and to support the family in the referral. We know it goes a lot smoother and we're able to help the child faster when the parent is involved in that referral. Next slide. Here's our website. If you haven't been to it, this is what it looks like. You can see we have a pull-down menu for parents, professionals, friends, and family. So we encourage you to check that out when you have time. Next slide. What happens next? So again, because this does change, birth to 2 and then ages 3 to 5, you can see it there on your screen, is that the referral, once you make it, it immediately goes and it automatically starts getting tracked. If the child is birth to 2, it's 45 calendar days. That includes snow days. We're in Minnesota, right? It includes summer, holidays, and breaks. When a child is 3 to 5, it is not more than 30 school days. So the school calendar, with us coming up close here to the end of our school year and summer beginning, we want you to continue to enroll, refer children, and they will be contacted. But again, the response and the plan and all of that follows the school calendar. So it changes school district by school district. Next slide. The importance of referral and screening. We have 5 developmental domains that we look at. And so this is why this gets to be a little different from the medical route, because in the school, we're looking for how the child interacts with their whole world, not just at a specific, like speech is very specific. So we look at their cognitive development, how they think and process information, their physical, which is large and fine motor, communication, how well they're able to speak, but also comprehend and understand what is being said. Their social, emotional, regulation, and adaptive. Those are their self-help skills. Then we also look at mental health, how they're able to express and regulate emotions, which ties in that social, emotional, form close and secure relationships. Every day we learn how important attachment is for little children to be successful Explore his and her environment and learn. So again, this is what we look for our referrals. If you have any questions, we encourage you to go to our website and check out the resources and our videos there. Next slide. Before I close here, importance of a triple referral. What does this look like? What does this mean? We'd really like you, if you're at the doctor and you know that the child is born premature, or you're able to identify a child is born with a disability, with a diagnosis, we'd like you to refer as soon as possible to education. And the same route, if you find out through the school, because you're part of ECFE or preschool screening, the medical evaluation. We want to see both happening simultaneously. And if there is a need for that triple referral, that's the mental health, where a mental health provider gets involved to provide additional services strictly around mental health for the infant, child, and family. Other supports, you're going to be hearing from Sean shortly about Help Me Connect and how they connect you to community programs. Next. Our resource page. Again, our website, this is your free local statewide resource, helpmegrowmin.org for children ages birth to 5. We do have a Facebook page if you're involved in that. They post often. Act early, learn the signs from CDC. That has a wealth of information and materials for you too. And then Help Me Connect, Sean's going to take over and introduce us to that. Thank you for your time and your attention today. I look forward to any questions. Early intervention makes a difference. Thank you for referring children.
Hi, I'm going to go ahead and take over. My name is Sean Holmes. I work at the Minnesota Department of Health. I've been with the Department of Health for over 26 years in a variety of different roles. Most passionately has been with the Children with Special Health Care Needs section, where I've done a lot of work on just helping to identify the little ones that may need some extra supports and getting them connected to services. And primarily the last 4 years, been sitting in a role as Help Me Connect coordinator. I'm really wanting to share with you today what has launched almost exactly 3 years ago to the date. It's next week. As a supportive wraparound connection point, so that families that are coming and looking for something that they're not sure where to start, that Minnesota has a one-stop shop. We have a place where everything is pulled underneath one umbrella. So we'll go to the next slide. Just wanting to make sure that everybody knows what was created on Minnesota Help Me Connect was really based on listening to providers, professionals in the community that families trust, where they start asking the questions of, and then families themselves. So when we launched in May of 2021, we launched to expectant and parenting families with young children. We say up to age 8, but families don't live in that early childhood bubble. So you will find information on Help Me Connect that actually extends for that family well-being support. And when we launched, we were really targeting professionals, because that's what we heard from families. They are looking to childcare providers, healthcare providers, spiritual faith community providers to help them be able to navigate, where should I start? I don't know who to ask. And so while Help Me Connect is very much a supportive entry point for anybody looking for resources, really we do keep going back to that professional lens. So as you go to helpmeconnectmn.org, and please know that, yes, we did have it look the same, sound the same as Help Me Grow, because we are partners. And we wanted those that have had established a 12, 10 plus year relationship with Help Me Grow to feel comfortable, to know that they are in the same spot, same colors, same blocks, scheme. Sometimes it does get a little confusing. I can say I'm definitely guilty of saying the wrong one at certain times, but I think that we're all in good company with that. When you go to helpmeconnectmn.org, you're going to see everything that we thought of, tried to chunk it into 11 different primary content areas. Each of those is really being able to support what already exists at a local level, not creating new programs, helping families navigate to what already exists at their local community. Currently, we have about 14,300 plus unique programs and services listed in Help Me Connect. Again, keeping in mind across the state, tribal nations, as well as a variety of different categories of services. And I'll show you a couple of screenshots in a minute so you can see what that means. Most importantly, as everybody knows, some of those other websites, they have this kind of data, but it might be in a county listing or it might be A to Z. One of the nicest things about Help Me Connect is you can put in a family's home address or their city or their county, and whatever you're looking for, the closest ones are going to pop up to the top. It was very important for us to have translations. So the higher levels of Help Me Connect are translated into Spanish, Somali, and Hmong. There is a drop down that I will show you on one of the screenshots, so you can see how to switch that back and forth if you're interested. And what I might show you today on screenshots, it's going to look a little different on your phone. I was actually playing with it this morning to try to make sure there's little nuances where I'll show something and it's not quite as I describe on a phone, but recognizing that that was done on purpose because phone screens have to be able to go back and forth in size, and we can't expect parents to sit and scroll all the way across a normal screen size. What I won't get into a lot of detail today, but we do have a training video that I'll point you to, is how you can create an account. So serving a family over a period of time, and you think of tons of things that would be really wonderful to connect that family to, but knowing they're really only ready for one or two, you can create an account and you can save all of those wonderful ideas so that the next time you're talking to the family, you don't have to start from scratch. You already have all of those thoughts pulled together in a saved search. Next slide. This is just a larger picture of those 11 content areas. So you're going to find, for example, Head Start, Early Head Start under a couple of these different titles, as well as other programs. So it isn't, it isn't exclusive that each one of these doesn't have some crossover. One of the nice things that we're learning every day is how families' intuition, how professionals' intuition may look different than what we first set up. And so we are always moving things around, adding new different elements and changing some of the wording to make it a little easier for families to understand. One of the items that has been included, I just saw the PDF go, is to help professionals, because sometimes just the overwhelming nature of Help Me Connect, you're not sure where to start yourself, is having a one-pager, a cheat sheet. So we did attach the table of contents to this as a PDF document, just so you can see all of those different programs and services that are currently listed in the Help Me Connect database. Next slide, please. I want to make sure that as we leave today, that those of you that have been successfully working with Help Me Grow, the referral system of getting children connected to those services and next steps, you don't have to change a thing by what I'm sharing with you today on Help Me Connect. It is a no wrong door type of an opportunity and partnerships. If somebody comes to Help Me Connect and they have a concern about a child's development, we will get them to Help Me Grow, as well as a bunch of other things that they might be interested in. And same thing, Help Me Grow now has a big purple box on it that says Help Me Connect. And so hopefully the same kind of an approach is if families come there or professionals, they are able to then push others for other content areas into Help Me Connect. Next slide. So this was one of the things that I really wanted to be able to share is Help Me Connect is sitting at the center. We are an entry point, a no wrong door, a one-stop shop. And what we are doing is we are pushing out to all of the programs that we know exist. And keep in mind, I say we know, because that's really been one of our struggles over the past 3 years of tell us what we don't know. Who is at that community organization level that we haven't heard about yet that we want to get added into? Because most of the professionals I've talked to, you have your tried and true resources that you are counting on. You already know what's there. So Help Me Connect get those families to those programs. So you can see here, every of those little circles, I just stuck a little logo, the Karen Organization of Minnesota, going to the Parent Aware website, the Follow Along program, Minnesota Indian Women's Resource Center. Every single one of these has a variety of partners. This is not just who we have. I could put up 14,000 probably of these little logos and maybe still not get the extent of our partnerships and our connections to what already exists at a local level. Next slide. So this is always my most fun because people are curious. What are users looking for when they come to Help Me Connect? So again, keeping in mind, we launched in May of 2021. We started tracking analytics in June. We are almost at our 3rd year marker. In that time frame, we have had 388,000 plus unique visitors. Many of them are coming back. So if you look at our return visitor rate, it's much higher. But that's always fun to look at. And where are they coming from? All over the state, neighboring states, really getting a feel for what some of our top areas are that families might be coming from or professionals might be coming from. The little blue line is our monthly hit rate. And so you can see what every Help Me Connect coordinator is going to want to see as it gradually is going up. We had a fun peak in December of 2023 with a very robust social media campaign that has since ended. So now we are really leveling out at more of a realistic rate, right into about 23,000 unique visitors each month. One of the nice things about joining this series is that our top 10 search queries, what people are putting into the website, is really highlighting what users are looking for. Autism does not ever fail me. It is usually in the top or the second top of the keyword searches. We know that that's where a lot of people are concerned. They know that that is a word that they might be worried about. They want to learn more, and they are coming to Help Me Connect for that information. Basic needs threw us off. When we started, we did not have anything about diapers. Even our autism information was very minimal. And so we've really added a bunch based on what people are looking for. And as you do start to go down our top 10, you do see some of those others: mental health, early childhood family education, the autism benefit of EIDBI. I know you're hearing more about that in one of the future series that's coming, I think, in 2 months. But I just really wanting to highlight, this is how we make changes to Help Me Connect, is we watch what people are looking for. We go in and we try it ourselves, and then we make changes based on knowing that it might not exactly meet the needs of those looking at it. Next slide. So instead of going to the actual website today, which is something that I traditionally will do, I'm going to just show you some screenshots, and then I will point you to where you can actually watch a little bit of the training videos. On our blue header, it was important for me to show you up in the upper left. That's where you can switch the languages. And again, we currently have Help Me Connect translated into Spanish, Hmong, and Somali. As you dig deeper into Help Me Connect, please remember that we had 14,000 plus. We could not translate all 14,000 of those different program service descriptions. And so it does revert back to English after you dig down a little bit deeper. If you click on the About, Help, or My Account, so the About right now is really pointing to the outreach materials. We have some updates that will be coming soon, which have some helpful handouts. We have videos, a podcast that was recorded will be coming onto that site. And then of course, some of the background information. Under the help, that's where you will find those training videos. So if you want to know how to create an account, to save your favorites, that's where you will find that, is under that help button, as well as other information. You can always request a more in-depth presentation from me where I will do a walkthrough demo. And then the My Account is really where you're going to learn a little bit more about what it takes to create an account in order to save your favorite searches. In the footer, which is that bottom part, every single page of Help Me Connect has our wonderful email address, and that is designed to hear from you, hear from users. What's working well? We don't usually get that, but we usually get here. I wish we could find this, or this didn't seem to work out quite right. All of those different types of pieces of feedback are so helpful as we continue to make improvements to the site. Next slide. So this is really still on that home page. In the yellow circles on the upper left there, that is where if you click once, you're going to get a drop-down menu. So as you can see there, the two arrows going either way. If I had clicked once on that, I'm going to see that that's called developmental and behavior concerns. And I can go right to one of those different data sources inside of that category. And so it's really what I call kind of that quick link, quick opportunity. If you click on any of the circles, you're going to be able to jump right to the different data elements that are housed in there. But in that center area, that's where I think of it as the exploration. Somebody might have a little more time on their hands and they want to read. So if I clicked on the big developmental and behavior concerns box with the little one climbing up the stairs, I'm going to get more text description about what some of those programs are. What is EIDBI? And so as you kind of look at the different ways of going right to who is offering programs at the local community, we're offering a couple of different opportunities. Can I read more and learn about it? Do I just want to jump right to those programs that are offering the service? Next slide. And then finally, this is really what you're going to get. If we were to go to one of our big categories, which is family well-being and mental health, we can click on early childhood mental health providers. Now we can see there are 94 data elements inside of our database that are pointing to an early childhood mental health provider. We can put in a family's address in that yellow box. We can filter even closer down to what we might have been looking for. So say, for example, under the additional filters, under specialization, I wanted to know who is really supporting Native American families. And so I could click that box and just see the 7 out of our 94 that might be supporting that. As you're looking at the search results, you can see everything from how far away they are from that family's home, their address, phone number, email, URL, and then more importantly, the area served. Sometimes families live on a border of a county or of a school district. And so always look at that area served, because the top one might not be the most appropriate. School districts and counties throw us off a little bit sometimes with families' addresses. If I were to click on St. David's Center on that blue highlighted line, I get more information, the program details, and I put just a little inset there so you can see that's giving more information about early childhood mental health services, as well as St. David's specifically. And we can really customize that to be able to support unique, traits or specifics that organizations may have. Really always wanting to make sure that if there are some unique specifics that we can get them added in, such as language support, cultural appropriateness, different types of services that they may have that don't necessarily fit across all mental health providers in this case. And next slide. So supporting professionals. We have a recent online order form so that professionals across the state that are supporting families with little families, they can order rack card, flyer, poster, now business cards. All of this is really to help you support getting the information out to families. We are currently staged to do a referral system launch for professionals so that they can make referrals to community organizations, and then they can receive information back to know that the family got connected with and they are receiving services, or maybe they decided not to. And that is right now slated for August. We have just started supporting doulas around the state so that they can be found on Help Me Connect, especially knowing that so many of them are supporting our diverse groups of families. We have a new family assessment questionnaire template that has, well, the template itself isn't new, but really wanting to make that be an interactive template. So that was just posted in the chat for everybody. What we know is Help Me Connect is very loud and colorful, and there's so much there. But there were some drawbacks to that. People just get overwhelmed and they don't know where to start. So having this kind of a template be interactive will help users say, yes, I was concerned about food. It's going to jump right to the area and Help Me Connect that supports food. I have a concern about my child's development. It's going to jump right to the Help Me Grow information. And then finally, really wanting to partner closely with the state's follow along program, where there are professionals already trained serving families in the community that are completing developmental and social emotional screening questionnaires. What can we do to have a family access portal on Help Me Connect? Also supporting those programs that don't have the capacity to do screening in-house. And next slide. So this is my last slide, really just wanting to share that Help Me Connect is evolving based on feedback from you, feedback from families. Let us know what is working, what isn't working, so that we can then communicate and get that into our technology enhancements. I've already shared with you all of the different places where you can go and look for some different resources, our about, our help, but then most importantly, in the footer, you have our email address. So I know we're going to transition here over into a question, and I'm going to turn it over to Michelle.
Thank you, Sean. Thank you, Linda. I can't thank you both enough for coming today to talk about resources and helping early identification and connection to supports and services. My name's Michelle Quickstead. I joined Dr. Hollandy and a whole group of people that are bringing this series to you to help you better support families in your communities. One of the parts of our series is to highlight a family story because, again, families are at the center of our work. And so when we think about what do these services look like for us, we want to give an example of a family story. So get your Q&A questions ready. Think of the story, and then we'll have some questions to prompt you, and we'll spend the remainder of our time together working around what are the strengths and what are the resources. So for example, a single mom with a 2-year-old is unexpectedly moving from Buffalo, New York to St. Paul in a month to live with relatives after a domestic violence incident. Her child is currently receiving early intervention services in New York, and she would like to know how to begin the services in Minnesota. The mom also expressed concerns about having to completely start over and would like information about resources that may be helpful, such as finding a job, food, support, and childcare. On our next slide, we have a list of questions for you to all think about. So as we transition to that next slide, think about these questions and how you might answer them, and use your Q&A to help us facilitate a conversation with you in this webinar series. So let's start off with, what are some strengths this family brings? How can we use these strengths to support them? Also keep in mind, what are some barriers this family may face, and how can we reduce barriers in this situation? How can we highlight the importance of connections with Help Me Grow early intervention and Help Me Connect supports and services? What should the parents or guardians do first, and where should we go with questions or concerns? Dr. Hollandy, would you like to start us off here?
Sure. Thank you, Michelle. I'm just going to start with the first question. I think no matter what the circumstances are, I always like to think first, what strengths does this family bring? What strengths does the child bring? Every family does, every situation does. And so I would say with this, first, it sounds like the mom wants help. The mom has already connected her child in the previous state to early intervention services, and upon moving here is already ready and wanting to find out what resources are available to connect her child. So we have a parent that really seems, despite some challenging circumstances, highly invested in early intervention. I think right out of the gate, though, I can't help but say a barrier is moving to a new state with different rules, different ways to access that. That's got to be a challenge. As a professional, I would be thinking about that. I guess I'm curious, Michelle or Linda, Sean, what are you thinking? Where does your brain go first?
Yeah, one of the first things that I think of as the early identification and intervention coordinator with the Department of Health is we have a family that's already connected, but how do we get them connected to their local school district to help them think about that transition, and what do services look like here in Minnesota? Linda, would you like to talk a little bit about how families could do that?
Yes, that is the nice thing about having our website or the phone number is they can, even prior to moving, they can already start getting connected through that, and we can learn more about them, because it is difficult to know what school district am I going to be in when I arrive, when I move. So, yes.
Thank you, Linda. And Sean, I think of you as a family's getting connected with that local school district. What if they had questions about diapers or specific resources like housing?
Absolutely. So one of the primary goals of Help Me Connect is to have everything pulled into one spot so that families would be able to do searching and find Minnesota information that could support them. One of the other things, though, is really being able to find a community organization that family may feel more at home in, so that if there is a diverse culture, if there is a language barrier, really trying to find maybe a supportive network where there's a person, a human being that can sit and talk with the family, and where they can connect with other parents or other family members that may have similar types of stories that they can relate to. So Help Me Connect obviously is a nice place to start. We want to get them into the hands of a human being that they feel most comfortable with going back to.
Thank you so much, Sean. When I think about this from a practitioner's perspective, I was an early interventionist for years before I was in this position. And I think while those are all great resources, sometimes there are barriers or roadblocks that happen along the way. So we'd love to hear from you as you think about what are the strengths the family brings. Put in the Q&A some barriers that you've faced and help us think through what are some ways we can get support to you. So we have a question in the chat now that says, or in the question and answer form, it says, I'm wondering how a family who speaks another language can find Help Me Grow and Help Me Connect. Sean, would you like to answer that first?
Well, obviously the materials, those that really, they either have subtitling in other languages, or we do have some that have, you know, a voiceover in the other languages. I think, again, the most supportive part of this, and one that this story didn't have information about, is does this family have a language barrier? None of that information was shared, so we would probably jump to the conclusion that no. But if so, really trying to pay attention to those community organizations that are speaking that language, that look like that family, that can be maybe a little bit more supportive. I do think all the time, though, we are looking at ways to do that differently. How can we make sure that we have the best translations and little audio files and everything that can really start to help families listen from an oral stage instead of just trying to read information? So we are moving that direction with Help Me Connect to have some little audio files.
Thank you, Sean. Linda, how would you answer that for Help Me Grow and having Help Me Grow resources available in other languages?
Sure. So our website, if you go to our website at helpmegrowmin.org, at the very top tab, it does ask if you would like Spanish, Somali, or Hmong. And so we do have it available there. I know there are additional, in our region, we also have a lot of need for languages that support Micronesian cultures. And so each region, because again, we're local, right? We can help with those local languages. And then also our phone number. So you can just choose which language you want.
Thanks, Linda.
Mm-hmm.
We have another question here in the chat. So this next question is asking, families living in a shelter with a child under the age of 2, can they choose to meet at a community area if there's limited space in the shelter or wherever they're living?
Sure, I can help with this. You know, during the pandemic, early intervention was taking place in parks when we were able to gather in person. And so, yes, the parents, along with the early interventionists, get to decide and determine which is the best place for that intervention to take place. Good question.
And then we have a comment. Our program covers 7 counties, most of which are very rural. Transportation is a huge barrier for our families. That's a great point, Carrie. Do we have any resources or strategies to address that? Or what would, Sean, Linda, what would you recommend?
So I can tell you that transportation shows up in the top 10 keyword searches all the time, to the point where the community ad hoc groups coming together to really be able to talk about what the gaps are, how they can be filled for certain situations. And so I definitely agree with you. Transportation is one of those that we have had some very direct conversations with state agencies that might have more influence over where the gaps are. But it is something in rural Minnesota where we are at times just going with our hands up like this.
Linda,
I
would
was
you
gonna-
add?
Oh, thanks, Michelle. And I would like to just add, you're talking about 7 counties. And so that's the nice thing about Help Me Grow is it is going to refer you to your local school district. So it would be probably the school district closest to you. And with transportation barriers, we do have community transit. A lot of communities or counties have a community transit, or through Help Me Connect and other local resources, they can connect you maybe to a nonprofit or a volunteer group, because getting early intervention is really important. I just encourage you to share that with your early interventionists, that is going to be a concern. And so we can talk about that and include that in the planning to see how we're best able to support you.
Thank you, Linda. I think transportation continues to be one of our top barriers. Each school district, if a family is connected with their school district, each school district has a McKinney-Vento coordinator. So when we think about highly mobile or homeless families that are particularly vulnerable to having transportation needs, the local school district might have additional resources. Medicaid sometimes also does cover transportation for medical appointments, and your social services or your local public health agency could help a family look into those resources as well. So just a couple additional ideas. Jen, would you add anything else to that?
No, I think that was very well covered. Great questions. Thank you so much. And again, there's a wealth of resources if you take a look at both the Help Me Connect and Help Me Grow websites. So thank you so much. And feel free, if there's any more questions, to type them in. Otherwise, I can close us out. And I'd like to note we're perfectly timed at 2:50. So great job, presenters. So next steps, thank you for being such a great audience, your great questions and your great listening. Watch your email. A survey will be coming out both for us to get feedback on this presentation, what you want to learn more about, how to shape our upcoming presentations, but most importantly, resources that you have found helpful in your practice and working with families. We want to capitalize or build on all the wisdom that's in this audience here. So please share with us and complete the survey. Once you do, you'll receive a certificate, as well as a highly valuable, highly informative resource sheet that we will compile and send out to you. So please watch your emails. Next slide. And please come back next month, June. We hope the weather remains beautiful. June 3rd is a really good presentation on mental health supports. We get a lot of questions about mental health supports in the early years. So please join us first Monday, June 3rd. And then note again, July 8th, we'll be doing the second Monday in July, due to the July 4th holiday, and then August 5th. And with that, thank you so much for attending today. Happy spring. Here is another tulip. I love tulips, can you tell? Thank you for joining us, and we really look forward to seeing you next month, first Monday in June, where we'll talk about mental health supports. Thanks, and have a great day.